Welcome, everybody, to the Mission Employable podcast, where we're talking about all things workforce here in the state of Iowa. My name is Ben Oldak, and I'm joined by my co-host, Kathy Leggett, from our Business Engagement Division. Kathy, how's it going? How's your Monday?
Monday's good. Happy spring, everybody, I have to say, because we're recording this on what is the first day of spring.
Yeah,
so.
and it actually, kind of feels like it.
Yeah.
Which is fantastic, because we've been through, the fake spring already, and now I feel like it's finally starting to roll around.
Let's hope. And I do have to do a shout out here to
Ben
in his bright pink, great looking shirt. If you don't see us via YouTube, just so you all know, Ben is a snappy dresser, and he is, and he's got a great shirt on for the first day of spring. So I just want to say, well done, Ben.
Thank you. I appreciate it. Shout out to Tiger Woods for wearing this color at last year's Masters. That was my inspiration.
Very nice.
Well, today's show is all about the field of direct care providers and the opportunities available throughout the state. Iowa's aging population is in need of direct care, I'll redo that. Iowa's aging population in need of direct care services is expected to grow 19% by 2040. With that, the need of direct care workers is going to grow as well. We're here with Di Findley from the Iowa CareGivers Association to tell us more about the career pathways available in this high-demand field. So welcome to the show, Di. How's it going?
It's going great, and thank you for the invitation.
Yeah, of course. So let's just kind of start off with an overview of your role at the Iowa CareGivers Association.
Well, my role is a director. I founded the organization out of my basement. It'd be 31 years ago in May. And before that, I worked as a nurse aide for about 13 years. So it's kind of consumed my life for over 40 years.
So what made you want to start it out of your basement? That's really interesting.
Well, again, having been there and done it and knowing that there was a need for support for this very essential workforce.
That doesn't change, does it?
It doesn't change.
No. Mm-hmm. And we're always going to need this. And I think, Di, why don't you tell us a little bit more about direct care workers and what kind of careers there are and what kind of work, just for people who may be not familiar with that.
Right. Well, it is kind of an ambiguous term. It's kind of this umbrella term, but direct care workers are, there are about 30 different titles that fit under that umbrella. But I think the Department of Labor and your department recognize only about 3 of those: home health aide, certified nurse aide, and personal care aide. But other titles include patient care tech, those who work in hospitals, rehab aides, medication aides, hospice aides, universal workers, and even some of the non-medical, companion services, senior companion services. So lots of different titles, and they work in a number of settings, and again, anything from assisted living, the homes of the individuals that they serve, hospitals, nursing homes, and other group homes and other settings. And the people they serve, they serve Iowans of all ages and all abilities: older Iowans, children with special needs, and adults with disabilities, and then again, those who may be experiencing an acute illness or needing care at the end of life.
Yeah, but the common denominator seems that this is like one-on-one care, correct?
It's very hands-on. They provide about 80% of the direct hands-on, very intimate care.
Yeah.
That's a big group. How many, do you know, Di, how many people in that category providing that service right now in Iowa?
Well, it depends on who you ask. Mm-hmm. If you ask us, it's somewhere between 40 and 65,000, because it's a workforce that's very difficult to track because they don't have like a certification board or like other health professionals do. And I think your department estimates are a little lower than that. But even in talking to Ryan Murphy, whom I adore, admits that it's difficult to pull in, and have an accurate count.
And what about right now? Do you have a feel? Because you said 40 to 60,000, I think, which is obviously a big group of Iowa workers. And what's the deficit right now? Like, what else? What do we need in addition to that?
Mm-hmm. Again. Your department just did a Zoom program for us here not too long ago, and at that time, I believe, I don't have the exact number converted to memory, but I know it was between like 1,500 and 2,000 vacancies for, and I believe that may have been just CNAs in the state right now. So,
Okay.
yeah,
Big need.
big need.
Yeah, and certainly, as we just mentioned kind of in the intro to this episode, growing.
Yeah.
What kind of attributes to that, the growing need? I'm just assuming that it's people getting older, that boomer generation kind of getting to the point where they need more care?
Well, that, and then I think people, well, especially the last 3 years, I mean, these folks have been on the front lines of this pandemic, and probably most of us have no idea what they've witnessed during that time. So there's a lot of burnout, not just in direct care workers, but nurses and other health professions as well. So that, I think that's certainly a contributing factor. And yeah, we're an older state and increased need.
Yeah, absolutely. So what are the kind of benefits to this job, and how could somebody get started in this career field if they thought that it was interesting to them?
Well, we might plug your high school registered apprenticeship program that
yeah.
I just learned about
Yes.
not that long ago. I think if people are interested in finding out whether this would be a good fit for them, they could check with their local community college and just do their homework and find out, what's the training like, what's the job, what does the job entail. And I think we need to present very realistic expectations for those going into the field. I mean, you can't sugarcoat it.
Sure.
This is hard work. Take it from me. I did it for 13 years. And they need to know that going into it. But I'm convinced that there are thousands of people out there who are compassionate and caring, and they want to make a difference in people's lives. And for those individuals, I mean, if you want to make a difference, you can do that in direct care. You can touch thousands of lives in a very positive way, and it can be very gratifying work. The other thing they might do is at the University of Iowa College of Public Health, there's a program called Prepare to Care, and it does need to be updated a little bit. It's one of those programs that has never really been totally brought to scale, and we would like to see that happen. But anyway, there is an online Prepare to Care core training, which is online. It's free, and anybody can go into that and do the modules just to find out. It's kind of a good introduction to what it might be to get into the health professions, just to see if it might be a good fit for them.
Yeah, and it sounded like you were speaking a lot from experience there in terms of how gratifying it can be to work in this field. Do you have any, personal stories that you could share with us about, people you've served or that kind of thing?
There are just so many. I mean, I think at the end of the day, and what we hear from direct care workers in Iowa is it's the little things. I mean, it's that connection. They love hearing their stories, especially if it's older Iowans and the experiences that they've had. And I know, some CNAs I was talking to just recently, despite the challenges that they've been through the last few years, the reasons they stay, they do glamour shots for their residents, they make snow angels. It's those kinds of things, anything that they can do to bring joy to people's lives.
This is, as you said, caring, compassionate, people who want to make a difference. This is an opportunity for you or anyone interested in this to make a positive impact every day that they work, and in a big way. And I'm curious because yes, you can't sugarcoat what a tough job this is, and I appreciate that. I think that's really important too. But is there? I feel like there might be some flexibility for people who maybe don't want to work full time or who are looking for something to be part of it. That they're giving back, they're contributing, they have some time. This might be an option for them too, maybe in some circumstances.
Yeah, an example of that would be older workers, like retired CNAs or home care aides. They one of the surveys that we did actually with Workforce Development there was a significant percentage of those individuals who said they would continue to work beyond retirement if some of the physicality could be, taken out of the work, and if the wages could be a little better.
Yeah.
So they could fill some pretty major gaps.
So, because I think a couple things that you mentioned, I just want to reiterate. Free online modules to just test your interest, perhaps. And so, what is there to lose if you do that? Now, I think, and I just have to say, I received an email. I know you think I'm going all over the place, but I really have a point here. So
I trust you. I trust you, Kathy.
Yeah. I received an email just before this, and I just had to write it down because it says, "The beautiful thing about learning is nobody can take it away from you." And that's a quote from B.B. King. And I just thought that was really relevant for today because it's so true, and we should be learning all the time. And this is a perfect opportunity, Di, that people could go on and check this out. And then again, I just want to go back, foot in the door. Maybe you end up loving it, and this is what you do the rest of your life, which is fantastic because you can truly change a lot of people's lives. Maybe this is your first step, and then you learn all of these things that are available in the healthcare world, and it leads to a next step for you. So I just want to encourage anybody who thinks they might fit this role or be interested to check it out.
Yeah, I think that's a really good point, Kathy. And the other thing I think we want to remember is I think there's a perception that people who do direct care work, it's an entry-level job, and there's an assumption that they want to go on and become a licensed nurse or a doctor or some other health profession. But for many, this is a chosen career. So referring to somebody who's been working in the field for 20, 30, 40 years as an entry-level worker probably needs to go.
Yeah, good point.
And not assume that everybody wants to go on.
Right.
But it could be both. I mean, if it's, an opportunity to go on and advance their education, or an opportunity to grow. And we need to provide more opportunities, I think, for them to grow in direct care because we need them in both areas.
So I wanted to talk a little bit about the Iowa CareGivers Association and your work with them and what you guys can kind of do to help employers recruit these kind of workers if they're looking for them, those kind of things.
Well, much of what we do, I guess you could just view us as a big support network for direct care workers, and more at the macro level, I guess, than at the macro or micro. We provide a lot of programs and services, and we know we keep people in the field. And there's a lot of focus on training and recruiting people, but not as much on retention. And so that's where our focus has been for years. So we do like a statewide educational conference for direct care workers, and we were the first to do that. I mean, it's pretty unique. Other health professions, have that opportunity, and it's great for them to be able to network, know they've got an outside support system, network with other, direct care workers across the state. And we always have a fun theme. The next conference is October 9th and 10th at the FFA Enrichment Center in Ankeny. And this year's theme is direct care, heavy lift, get pumped. So it's always fun. People come in, they dress in theme attire, and really get into it. But they're also involved in the planning of it. So there's a lot of personal ownership of that event, and exhibits, great speakers and topics to enhance their education, their knowledge, and skills. So that's one thing that we provide to help keep people in the field. And our statistics from our evaluations, I think, are pretty impressive. Our conference last year, and we ask these same questions every year, for years we have, but between 90 and 100% rate the conference excellent or very good. Between 90 and 100% say they can use the information learned. Between 80 and 85% say their participation increases the likelihood that they're going to remain in the field of direct care. And 75 to 82% say that, and this is like years of evaluations, say that their participation increases the likelihood that they will remain with their current employer. To us, that's huge. that's how we can help employers, by providing that external support. We do a leadership training where they become kind of spokespersons of their profession and role models, and then resources like newsletters. Again, everything is tailored to them and information that's pertinent to them.
Yeah. Is this something that employers can collaborate on you with you?
Absolutely.
Yeah.
We would love for them to. And we do have good partnerships with many. I mean, like home care, the county public health entities, and a number of employers send their people to our conference.
I just want to, and I want to highlight that because retention is a huge issue right now with employment. We know we have lots of challenges in the workforce. Retention is one of the big ones. So as an employer, if you're an organization that utilizes what we are saying direct care workers, but any of those professions that are helping, people on that very important base level there, day to day, I think that they need to check out your organization if they haven't, and they need to consider, or I would encourage them to consider having their employees be part of it, because I think it sounds like it could be a real benefit to them, and it carries a lot of value.
Thank you. I would agree.
Yeah.
Speaking of which, why don't we plug that website?
The website, www.IowaCareGivers.org.
Perfect. So that's again for people who want to either get their employees involved or people who are in the direct care field that may not have had a chance to get to know the Iowa CareGivers Association. Make sure you check out that website.
Right.
Yeah.
And on the homepage, they can sign up for the Direct Care Hub, which is our newsletter, at no cost.
Wonderful. Just one more, plug or highlight about the importance of the work that direct care workers do. They are taking care of our loved ones every day, and this is, like we said, it's a great career field. It's a giving career field, and I just want to encourage people to consider it or share the information if you know somebody who's looking for something and would be really good at this, because it's I don't know. I don't know how to say it. I think if we really sit around and think about it, many of our relatives or our friends' families are relying on a direct care worker right now to help somebody that they love and care about. So
Right.
Yeah.
And the other thing I would like to mention, if there's time, we had talked a little bit about the impact of this workforce, and I don't think, unless you've experienced firsthand the need for someone to help you, we really have no idea the impact that this workforce has. And not only do they have impact on us, I think you asked who we wanted to help, and it's like, well, Kathy Leggett, we want to help you, and Ben, we want to help you, and all of your listeners, but joking aside, there's an element of truth to that. And so they have an impact on the consumers that they serve, the employers who are desperate right now, filling vacancies, family caregivers, and many family caregivers are employed. So when they get to the point where direct care workers are not there to provide some of that backup support, when they can't be there 24/7, they may have to reduce their hours at work or give up employment. That has an economic impact on their financial security and for the future. And it also has an impact on the business community when they lose those folks, and it impacts their productivity. So the impact of this workforce is far-reaching, and I want people to know that, and we need to be doing all that we can to support them.
Absolutely. Well, Di, thank you so much for stopping by the podcast. We had a good time talking to you, and just, again, the importance of those direct care workers is just, it's hard to kind of put into words how many lives they touch. And we're just happy that you're here and sharing the word and everything. And again, if you're somebody, an employer or a potential employee or someone looking to get into the direct care worker field, make sure you check out Iowa CareGivers Association, because they're doing a lot of good work.
Thank you so much. And Ben, I love your shirt too.
Oh, thank you. I'm 2 for 2. All right. Thanks, Di.
Yeah, thank you.